Anastomosis is a noun meaning the connecting of parts, branches, or openings of normally divergent structures. The five-syllable word is pronounced anastomosis. The second and fourth syllables, nas and mo, are stressed or accentuated, anastomosis. The second syllable, nas, has a vowel a pronounced the same as the a in apple or cat. The fourth syllable, mo, has a vowel o pronounced the same as in the word open. The first and third syllables have different vowels, a and o, but both are pronounced like the a in the word about, which is a neutral, unstressed, relaxed vowel sound called a schwa. Anastomosis. Lastly, the final syllable sis rhymes the words this and miss. In botany, leaf veins can exhibit anastomosis as they branch and reconnect, forming net-like patterns known as reticulate venation. In potamology, anastomosis occurs when a network of multiple interconnected river channels develop, split apart, and then rejoin downstream, forming a pattern of branching and reconnecting waterways. A river's anastomosing channel pattern creates vegetated islands. These islands are generally more permanent and stable than the bars found in a braided river. In this sentence, the word anastomosing is a participial adjective. In geology, mineral veins, such as gold and white quartz, anastomose by splitting apart and then rejoining, forming an interconnected pattern rather than a single straight fracture. In this sentence, anastomose is a main verb. In optometry, the episcleral and conjunctival vessels form an interconnected network through anastomoses around the anterior portion of the eye. Allergies, irritation, and physical exhaustion may cause these vessels to dilate, producing redness. In this sentence, anastomoses is a plural noun. In anatomy, a surgical anastomosis is a medical procedure creating a connection between tubular passages such as arteries or intestines. An intestinal anastomosis is a surgical procedure that connects two healthy segments of the intestine after a diseased or blocked portion is removed, or to bypass a blockage. First, the blocked or diseased portion of the intestine is removed or is resected. Then, the remaining ends are joined together, forming an anastomosis. A vascular anastomosis is a surgical connection between blood vessels. In coronary artery bypass grafting, or CABG, a blood vessel is obtained from another part of the body and used to bypass a blocked coronary artery. In cardiothoracic surgery, two commonly used conduits for coronary artery bypass grafting, or CABG, are the saphenous vein graft, or SVG, and the left internal mammary artery, or the Lima graft. Both rely on vascular anastomoses to create new pathways for blood flow to ischemic regions of the myocardium. In cardiothoracic surgery using a Lima graft, the left internal thoracic or mammary artery, which remains attached proximally to the subclavian artery, is divided distally from the chest wall and anastomosed to the coronary artery distal to the obstruction, thereby creating an arterial bypass around the blockage. In cardiothoracic surgery using a saphenous vein graft, or an SVG, a segment of the saphenous vein is harvested from the leg and is used as a bypass conduit. A proximal anastomosis is created between the graft and the ascending aorta, while a distal anastomosis is created in the coronary artery distal to the obstruction, thereby establishing a bypass around the blockage. Anastomosis.